everyone, this is Phil Lineberger, and if you're new to the channel, one of Carestream Dental's senior reps. I'm also a training specialist for the US and Canadian markets. And over the years, I've been pretty much focused on creating content that will help doctors and team members maximize the applications within our software, and then translate that to the absolute best patient experience and absolute best patient outcomes. So this video is for the doctors. I train a ton of you on using our 3D software. And the one thing that I see on a regular basis with new users, experienced users, and everywhere in between is tunnel vision. Okay, so what do I mean by that? I mean, you take a scan for a specific reason, and then you only focus your attention on that part of the scan, and you neglect the rest of the scan. And this isn't helpful to anyone, you nor your patients. You might miss something that affects something specific in that treatment plan. You might miss something that affects you medical legally. You might miss something that affects your patient outcomes. All of these reasons make it extremely important to rid yourself of this tunnel vision. Now, I'm not a doctor nor a radiologist, and I'm not telling you how to read a scan. I am simply reminding you to invest the proper amount of time and review your scan. And if you're not sure about something, that's okay. That's why we send cases to the radiologist. Dr. Leah Matny is Carestream Dental's clinical specialist, and she also has her own private practice, See-Through Reports. I'll put a link to her website in the description, and I'll also put a link to one of her CBCT interpretation webinars in the description, and you can click on that and watch it anytime you want for free. The following case is a very typical example of something very obvious that you could miss by not reviewing the entire scan. Check it out. Okay, so here's one case example, and this patient was scanned for implant planning in the mandible. And there's a couple things that I see some users will do is they're going to simply focus in on the mandible. So you could zoom in and then take my cross-sectionals and then treatment plan everything in just the mandible. By doing that, of course, we're neglecting evaluating the entire scan. Or another thing that you might do, instead of zooming in like that, you might use the region of interest tool and crop out the entire maxilla. And there's benefits to that because everything gets nice and large. You have a bigger area to work with. But the downside, of course, is you're not visualizing the entire scan. The region of interest tool is definitely helpful and you should use it. I'm just saying review the scan first. Okay, so let's move this back to evaluating everything. And in a case like this, you've got a couple of really important things that you could have missed. And there's probably more. I'm just focusing on a couple of very obvious areas that could have been found if you evaluated the entire scan. So one, as I take my cross-sectionals and zoom in a bit more, you can see this very large incisive canal cyst. All right, something that really could have been easily diagnosed if you looked at the entire scan. Okay, so what next? Let's go ahead and thicken up our slices like a regular panoramic view, and let's take our cross-sectionals and align on the long axis of this implant. And we're just going to scroll back and forth over the implant. So we can see the beam hardening on the facial aspect of the implant, and as I scroll towards the distal aspect of the implant, we can see a very large area of bone loss. So again, these are just fairly easy things to find as long as you take the proper amount of time and go through the entire scan. So I hope this is helpful. We'll see you guys later.